Hi, how are you? If you're part of the healthcare staff, this information interests you. Today we want to tell you how the STEP monitoring tool works. STEP monitoring is a computer tool that supports us with the follow-up tasks with patients of cancer and other chronic diseases. In addition to making the work of the healthcare team much more comfortable, during treatment, STEP monitoring improves the quality of life of patients who, with this system, become an active part of their monitoring process. We're a very close figure to the patient. We attend to them, we accompany them, we empathize with them. We're attentive to their well-being, we schedule visits with them, we also monitor them. The follow-up that we do of their disease is key in its evolution and in its treatment. STEP monitoring makes it much easier to automate review tasks that we have to carry out by using all the data reported by patients in follow-up. This allows us to monitor a greater number of patients. We can know how patients are at all times without having to wait for the next consultation to collect more data. With STEP monitoring, the patient's history is automatically updated as questionnaires about their health are periodically answered on their mobile phone. These data are added to the data we have already collected in in-person consultations. The result is an optimization of the monitoring process, since the information is expanded and, above all, possible complications are detected earlier. This is the main value of STEP monitoring. It immediately alerts us to any worrying sign, allowing us to act quickly and prioritize patients in a situation of suffering severe adverse effects. In the case of patients with chronic diseases, we already know that acting sooner means saving lives, improving their quality of life, or even having the opportunity to change treatment in time so that the prognosis is much better. Imagine the specific case of a severe infection that could have been detected sooner had the patient simply alerted us of the moment they had started to feel feverish. This circumstance can lead to the patient's admission to the hospital and even the interruption of treatment to stop the infection, with the negative consequences that this may have in the evolution of their cancer. With STEP monitoring, not only are we going to do follow-up more comfortably, but we're going to be able to improve the prognosis and results of patients. And very importantly for us, they will find themselves as well as possible throughout treatment. The STEP monitoring system consists of three main tools that act interconnectedly. STEP Cloud. It is, let's say, the brain of the system. There, in the cloud, the data is stored, both those collected by us and those reported by patients from outside the hospital. STEP Web. It is the computer program with which doctors and health professionals monitor patients. This is the management tool that we're going to use in our work, either from the computer or from the tablet. STEP Web is a very visual, intuitive, and easy-to-use program. The creators of STEP have put a lot of effort into studying our needs and designing a tool that perfects and makes our work easier. Finally, there's STEP App, the application for mobile devices that patients will use to complete their questionnaires remotely. This is the step-by-step functioning of the mobile application for patients. The doctor, when deemed necessary, prescribes STEP App to a patient. To start working with the system, the patient must sign the informed consent. Once this is done, we register the patient in STEP Web. After registration, the patient receives an email with a link to verify that this is indeed their email. After verification, they receive a new email with a provisional user password, a link to the corresponding app store, and help information to download STEP App easily. After downloading the application and logging in for the first time, the patient must accept the terms and conditions and change the provisional password to a permanent one. The patient then completes the profile questionnaire. From this point on, they can begin to use the application. In STEP App, the patient has a series of questionnaires assigned by the clinical team at their disposal. The objective of these questionnaires is to acquire data about the quality of life of the patient and their well-being during treatment. These questionnaires are automatically generated according to the patient's situation, who can fill out and send each one in the manner they prefer, all at once or in parts. What they do have to be aware of is reporting it to the medical team before the deadline. Finally, it's important to know that, apart from the questionnaires, the patient can report symptoms at any time, which allows the medical team in charge of their follow-up to assess the situation in an updated way and make decisions as soon as possible in case of need. As you can see, step monitoring is a very beneficial tool for our work, but also for patients. We are the closest people to explain to the patient the correct way to use this mobile application. But above all, we are the ideal people to convey the benefits of being an active part of the monitoring process. It is positive that the patient understands that with the simple help of their mobile phone or tablet, they will be even closer to and in more permanent contact with the medical team in charge of their case. It must be made clear that answering the questionnaires helps us detect complications early, and that this can help them feel much better throughout treatment and progress better. It is also advisable to highlight the added value of the simplicity of the application, intuitive and very easy to use. We hope this information on step monitoring helps you in your daily work. For any questions, you can contact Step Monitoring Technical Support at the following address: support@naruintelligence.com.